Cerumen is nothing but a waxy accumulation. So what happens is, some patients might have excessive secretion of the wax material, and this requires an intervention by the audiologist or a physician. So coming to cerumen removal, you need to know whether the cerumen is impacted or not, because the CPT code is actually for an impacted cerumen. And when the physician is going to remove the cerumen, you should know whether he is removing via irrigation method or is he using any curate or any forceps or any surgical instruments, because we have specific codes for instrumentation and for drainage. So please report the codes whether the removal is via drainage, that's via irrigation, or by the usage of any surgical equipment, that is via instrumentation. Next, the common procedure is a tympanostomy. An ostomy is an artificial opening into a eardrum. So this eardrum has a medical terms like myringo or tympano. Now what happens with a chronic, say a patient is suffering from a chronic otitis media. So what happens if it is left untreated, this might result in a perforation of the eardrum. So tympanic membrane perforations are also common. So at such times, the physician will be doing a procedure called as a repair, which is a Myringoplasty or a Tympanoplasty. In a Tympanoplasty, he can also do via a patch Tympanoplasty. A cigarette kind of paper is being used to close a perforation. As we have discussed, what happens whenever the patient has a mastocytitis, there is a tendency for the middle ear to get infected. Or when there is some other pathological conditions like oval window fistula or a round window fistula, the lymphatic fluid from the inner ear can also come into the middle ear, causing effusion. So in such cases, the pressure within the middle ear cavity is very much elevated, and now the physician will have to ventilate the excessive fluid outside. So this is called as a ventilating tube placement or a tympanostomy or a PE tube, which is a pressure equalizing tube placement. So what happens is, the physician is just going to place a tube into the eardrum so that he can drain the excessive fluid outside. So here you need to know whether the physician is giving general anesthesia or not, whether it is for the placement of the tympanostomy tube or is it for the removal of the tympanostomy tube. You need to know that as well, because for removal also we have the usage of anesthesia.